Hello, everyone, and welcome back to the Calm Over Cancer Summit. I'm so excited to introduce today's guest, Jeanne Tregilgas. Jeanne is a two-time stage 4 cancer thriver and board-certified integrative and functional nutrition practitioner. Jeanne currently leads the Metabolic Health Department at Biodynamic Wellness and serves as a global mentor with Metabolic Regen. What makes Jeanne's work so powerful is that she has lived it. After walking through advanced cancer twice, she's now helping others rebuild health, balance, and confidence after treatment. Her session today, Thriving After Cancer, More Than Surviving, is going to explore what real recovery looks like once treatment ends, how to repair your terrain, calm oxidative stress, and restore immune and emotional balance. And we're in for a real treat today because Jeanne has not only agreed to be here in conversation with us, but she has prepared a beautiful PowerPoint presentation that we're going to walk through together. So, Jeanne, I think it would also be helpful for other individuals to know that sometimes going to the doctor doesn't immediately provide you with all the answers. If you would, can you share a reflection of what these last 10 years, how your health journey started and how you got to being where you are today?
Yes, thank you, Adele. It's an honor to be here. 10 years ago, I started experiencing a health decline and went to my primary care doctor, which then led to going to dermatologists because there was some skin issues, going to an OBGYN, there were hormonal issues, going to a GI specialist due to some stomach issues. And it escalated over 3 years without any true single diagnosis on what was happening. And I had a massive health decline to the point of being bedridden and having my father-in-law live with us at that time to help with duties I no longer could help with. And I eventually was blessed in an ER department with an amazing doctor who decided to do a simple chest x-ray. Can you believe in 3 years of going to the doctor, I never had a chest x-ray done. And that chest x-ray showed that a third of my torso was full of what he believed to be lymphoma. So he sent me for a biopsy the next morning, which did confirm a lymphoma diagnosis. And as you can imagine, my husband and I didn't necessarily feel safe and secure with the medical system. So we started to explore other options, which led me to a Dr. Nasha trained doctor that I didn't even know was Dr. Nasha trained at that time. With my situation and it being blood cancer, she did advise I would need to do conventional treatment at that time and that she could help support me through that conventional treatment, but she felt it was necessary, the conventional treatment. So I went to an oncologist that works a lot with her. And the two of them got me through my first diagnosis by thinking outside of the box. And I was able to achieve a remission that lasted almost 2 years. And at that 2 year mark, I did relapse with a stage 4 relapse. After that, I went through conventional treatment, again supported with a metabolic approach, and then had a transplant. And I have now been just about 3 years out from that transplant and continue to live the metabolic approach. Through that 10 years and my first remission, I was actually blessed to join the clinic of the doctor who helped me to help her help others.
Thank you for sharing, trying to get a diagnosis initially and finding out what's going on. And I know that in the work that you do today, that's one of the things that you help people with, unraveling and looking at patterns so that if there is something that hasn't been identified by your doctors, then as a terrain advocate, you can help to identify those pieces. Jeanne, your presentation, Thriving After Cancer, it's a brilliant presentation, everyone. And so Jeanne's going to screen share with us, and I'm just going to give it over to you. Thank you, Adele.
Thank you, everyone, for your time today. I'm really excited to share some information with you that I hope brings hope and clarity on maybe the feelings you're going through and how your body might be feeling after treatment. I've had a cumulative of 4 years of chemotherapy, immune therapy, and a stem cell transplant. So I understand that perspective of living through it. I also understand more of the side of looking at your health and when to know how to support it. So today, we're going to talk about thriving after cancer, which I believe is more than just survivorship. A medical disclaimer: this presentation is not medical advice and is for educational purposes only. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment before undertaking a new healthcare regimen, and never disregard professional medical advice. The fight of your life is over. You've rang the bell. So now what? You are going to be moved into what is called survivorship if you have done conventional medicine in your cancer journey. This is me the day I reached survivorship. So transplant is over. The trifusion got pulled from my chest and they told me to ring the bell. My question, which I think has an obvious answer, is, do I look healthy? Do I look like I'm thriving? Survivorship programs currently do not address some of the most important factors that I believe and have seen myself need to be addressed after we ring the bell, which are cancer stem cells that are not addressed by chemotherapy, radiation, or surgery, the oxidative stress storm that happens as a byproduct of the therapies that were used to treat cancer, balancing the immune system after treatment, changes in the gut microbiome and the nutrient depletion that we experience as we go through treatment, changes in our metabolic health from the different drugs and treatments we have to use, and our medical and emotional health after treatment is complete. I would like to look at our success rates of our current survivorship programs. So in survivorship, you essentially wait what's called the watch and wait program. So you will come in for scans and blood tests, and you may have a social worker talk to you about some life rehabilitation programs, some PT. That's essentially it. They're not going to address those other topics I just talked about. What's interesting is that the National Cancer Institute is saying that nearly 1 in 5 cancer diagnoses today occurs in an individual who already had a previous cancer diagnosis. That should be shocking to us. And our primary care for relapse rates for our primary cancer do vary greatly by cancer type, stage, and the treatment. So there is not one number that really is going to vary by the individual. The treatment that you did receive would be considered palliative, which could mean life extending, or curative. And hopefully that is a conversation you had with your oncologist prior to receiving treatment. But if you had not had it, then I encourage you to have that conversation at one of your follow-ups to see if your treatment was considered curative or if it was considered life-extending care. The benefits of risks for the continued screening that you're going to encounter as a cancer survivor should also be taken into account. The screenings vary, again, based on cancer type. Likely, you'd be looking at CT scanning or PET CT scanning. There is a risk noted, again, by the National Cancer Institute that the radiation from X-rays alone can damage DNA and cause cancer. From the American Cancer Society's numbers, one PET CT exposes your body to the equivalent of 250 chest X-rays. Although they are necessary at times, it is still important to know the benefit and risks. For instance, my case, I had a blood cancer. PET CT is how they continue to screen to see if the cancer has returned. So it was a benefit versus risk conversation with my oncologist. There is still a better way to that standard screening. For me, even though I had to do the PET CT scan, I used high-dose melatonin, prior to my screening, and it's a great option that is well studied that you could discuss with your provider. There are other screening options that are not covered by insurance, but are options that you could discuss with your provider. I've listed 3 options here for you. The Prenuvo scan is a whole body radiation free MRI option that would not be covered by insurance. QT imaging is also a radio free quantitative transmission ultrasound that makes a 3D image of the breast. This would be in place of a mammogram if your provider would utilize it. However, that's also not covered by insurance. And lastly, ultrasound is something that may be covered by insurance. However, this option is going to be very dependent on if it is a localized tumor and if it will give your oncologist enough information. I have some other ways that you also can look at how your health is doing post-treatment outside of our standard of care scanning and our other options scanning, and that would be Dr. Nasha's trifecta. Dr. Nasha has 3 tests that, when all elevated together, give us an insight of disease progression and how the body is doing. Those 3 tests are a high sensitivity C-reactive protein, sedimation rate, and an LDH. All 3 of these tests are going to give us a clue of systemic inflammation, and if all elevated, could be an indicator of progression. I am going to give these in a PDF form to Adele to share with you so that you can have them for reference.
Thanks, Jeanne.
Another well-studied important prognostic factor in all-cause mortality, and specifically cancer reoccurrence, is the neutrophil to lymphocyte ratio. This is going to give us information on how balanced our immune system is. All of this information can be found on a complete blood count with differential, which your oncologist is probably already running at your checkups. And on that test, you want your total white blood cell count to be between 5 and 7. And then in the differential, you'll find your neutrophil and your lymphocyte counts, which you will divide your neutrophils by your lymphocytes. And you want that ratio to be between 1.95 and 2.05 to give the best picture of a balanced immune system. One large topic to discuss with your oncology team is going to be, how do you address cancer stem cells? I'm going to specifically talk about chemotherapy, radiation, and surgery. Some newer immune modulating treatments like cancer stem cells are less sensitive to chemotherapy, radiation, and surgery, and are believed to be a major driver of metastases and recurrence. Like normal stem cells, cancer stem cells can divide to create more cancer stem cells, which give rise to more rapidly dividing daughter cells that become the tumor that you eventually can see. I believe true healing happens after you ring the bell. If you've not implemented an integrative approach throughout cancer, this is when you can really start to address the terrain, even after conventional treatment is done. The first fire you're going to want to put out is oxidative stress and inflammation. Chemotherapy and radiation by nature are oxidative therapies, and they help to kill rapidly dividing cells by creating too many reactive oxygen species in the cell. The problem is that the oxidative stress from those treatments itself lasts long after treatment is complete. Think of oxidative stress as the rusting of your cells. So our goal after treatment is to help put out the fire, to help lower the oxidative burden on the body. I've listed here a few ways that you can go about those right away. One would be to really focus on your mental and physical stress, oxidative stress, and inflammation. Stabilizing your blood sugar and insulin with carbohydrate restriction is going to help lessen the burden. An antioxidant-rich diet with teas, spices, and microgreens, for example, are going to help. Grounding for 30 minutes daily with your feet on the ground will help to neutralize the free radicals in your body, optimizing your sleep and your circadian rhythm, and optimizing your minerals. Gut repair is the next phase that I like to go into after we have calmed the oxidative stress. Chemotherapy is known to adversely affect the gut microbiome, creating dysbiosis and negatively impacting health. The 5R protocol, which is a standard protocol in the functional medicine realm, is a great way to approach this even on your own. We want to remove any inflammatory foods that are going to impact your GI. Think gluten, grains, and dairy and sugar. If you could eliminate those or start to lessen them, that will be great. We're going to want to replace with foods that are more nourishing to the body. Reinoculate. With that, you can think to start adding ferments in, so yogurts, sauerkrauts, anything that your body can handle, going low and slow after treatment. Repair. You're going to want to eat things like bone broth, perhaps aloe vera if you can tolerate it, to help repair the barrier of your GI wall and then rebalance, which is going to be bringing balance back to your stress cycle, your life, sleep cycle, and to really just go through this 5R protocol beginning to end more than once, because the gut healing process after chemotherapy, radiation, or surgery is going to take time. Nutrient replenishment after the gut has repaired is the next phase of thriving after cancer. I always say a food first approach. We don't want to just throw supplements, especially to a GI that we are healing. Nutrients to really focus on are vitamins A, D, and K, selenium, zinc, magnesium, and optimizing your omega-3 fatty acids. Remember to test and not guess with just throwing supplements into your system. It's really important that you work with a practitioner, and a supplement line that I trust and use is MitoVita. Optimizing insulin after treatment is incredibly important. And as you can see, a lot of these overlap each other. So optimizing your oxidative stress fits in with optimizing insulin, and they also work with optimizing nutrients and gut healing. Chemotherapy drugs can disrupt the body's ability to regulate blood sugar and impact insulin, especially when combined with steroids. Steroids used throughout treatment make the body's cells, muscles, and liver less responsive to insulin, increasing insulin resistance. And the body's response to radiation therapy can cause a temporary release of extra sugar into the bloodstream, leading to higher than normal blood sugar levels. Insulin resistance is a critical cause of metabolic dysfunction and is common in patients with cancer. It is associated with a higher chance of recurrence. Smart movement after cancer is well studied and very important. The most important advice I can give is to try to do 30 minutes of brisk walking daily. Outdoors would be an added benefit, but what we don't want to do is too much high intensity training right after treatment. That will just kick up more oxidative stress and add fuel to the fire after treatment. Some other smart movement after treatment could be Pilates, swimming, body weight movements, walking with a weight vest, and slow movement strength training. Environmental cleanup is going to be key. You're going to want to address what you put on, in, and around your body. I recommend you use environmentalworkinggroup.org as a resource to start to look at what are you exposed to daily. And if you're feeling overwhelmed about the potential of looking at everything at once, I always suggest to start with air, water, and food. They're the three most common exposures of toxins, and you're going to use them the most regularly. So if you can start with water filtration, air filtration, and organic regenerative farming, low carbohydrate whole food sources, that is going to be a wonderful start to lessen the burden. If you would like to do a deep dive on your entire environment with work and home, I suggest you schedule with an advocate at mtih.org who can do an environmental deep dive through the Terrain 10 with you. Mental and emotional support is one of the most important, and I would say longest lasting areas after treatment that is going to be needing to be addressed. Waging the war on cancer dysregulates your nervous system. It's okay to not be okay once you ring the bell. And I would say it's okay to continue to ebb and flow out of not being okay. We do see in studies that patients without recurrence have a higher social support system. Connecting with an advocate or joining a support group, if you do not have enough support, would be great ways of helping to start to explore the mental and emotional needs you have after cancer. According to the American Cancer Society, only 5 to 10% of all cancers are caused by inherited gene mutations. This is good news. That means there's something you can do about it, and everything we have discussed today are going to be supporting your mitochondria. The tools that I gave you today are lifestyle and dietary interventions that you can implement immediately. If you would like to go a step further in addressing the cancer stem cells that do stay after chemotherapy, radiation, and surgery, I suggest finding a practitioner through mtih.org who can do a full health workup and utilize tools like fasting, hyperbaric oxygen, mistletoe, IV therapies, and off label prescriptions that can help to address the terrain of your immune system and to address the potential of those cancer stem cells so that they cannot give rise to rapidly dividing daughter cells. The steps that I suggest you take are number one, to find a terrain advocate. You can go to our directory at mtih.org. On the left side, you'll see the dark blue box that says find a certified practitioner. When you click on there, you're going to see 2 tabs, one for an advocate and one for a practitioner. And you have a search bar in there so that you can search for an advocate or practitioner in your area to see who's taking new clients and to see if they would be the right fit for you. I would also suggest an integrative provider through that same directory, and your provider and your terrain advocate can help connect you to mental and emotional support that would be the right fit for you.
And of course, you can always reach out to me because I am a certified metabolic trained advocate and working through the AIMS program as a practitioner right now as well.
I have a few resources here for you. The advocates and practitioners, both myself and Adele, would be on that mtih.org. You'd be able to find us there and find a contact. And then several books I have for you: The Metabolic Approach to Cancer, Fasting Cancer, Outside the Box Cancer Therapies, and Radical Hope.
Jeanne, wow, that was incredible. I think there's so much wisdom packed into that very short session that you prepared, and we're very grateful for all of your sharing, mentoring, and learning that you've exposed us to. I'd like to just pull together a few thoughts before we go forward on some of the things that you mentioned and touch briefly on them. You mentioned oxidative stress and inflammation as the first fires to put out. And you also shared with us that in your health journey, these fires were burning 3 years before a diagnosis. And so, for someone who's now newly post treatment, where's the most realistic, or I guess it could be anyone, but where's the most realistic place for someone to start if they're looking to address inflammation and oxidative stress?
I would say the key areas to start would be to stabilize blood sugar, working on therapeutic carbohydrate restriction. That would be a great place to explore with an advocate. Maximizing sleep. So, really looking at circadian rhythm. And then one that's the easiest fix right away would be just to start grounding 30 minutes a day, bare feet on the ground. All three of those would be simple ways that you could start to address it. If you needed to layer on additional therapies, you could see a practitioner, but an advocate could really start to dig into an environmental audit as well to look at what are some things that may be driving that.
Very interesting. Now, you talk about true healing happening after you ring the bell, and you shared some pictures of your journey and what it looked like with you in that hospital bed as a survivor in that moment. Whew. Wow. And look at you today. You're just one of the most beautiful humans that I have the pleasure of knowing. For those that are listening, what did that true healing look like to you personally? And you could just share a bit of what you did.
Yeah. I would say I'm still on that journey. So the healing physically is what you begin to do first. It takes a long time to go from that picture to feeling like yourself again, especially I would say for a woman after transplant, even our identity and whether it be our hair or some women have to have surgeries. So that was the first layer was it's easy to say I'm going to deal with oxidative stress. I'm going to have a practitioner help me with some gut healing. It's the mental emotional toll that is longer lasting and just the experience that cancer patients have continuing to go in for their checkups, continuing to go in for their scans 5 years out. They're still going to those appointments. The physical parts of addressing oxidative stress was this is how I did it in the presentation was exactly how I have addressed my health was cooling that fire, healing the gut, replenishing nutrients, dealing with any other inflammatory side effects from treatment itself. I do work with a practitioner who helped with therapies post treatment to continue a sustained remission. And then the mental emotional journey is one that I'm still on.
Thank you so much for sharing that with us. You have such a heart centered and practical approach and presentation. You've given us not only hope, Jean, but tangible steps to rebuild health after treatment. You've really shown us that from restoring the gut and replenishing nutrients to finding calm within the chaos, true healing is an everyday happening, and you have everything within you to make it possible. And so, thank you so much for being here with us. And to everyone watching, remember, surviving is the start, but thriving is where the healing truly begins. Thank you so much, Jean.
Thank you, Adele.